your stem.
Okay, ma'am, I'm ready.
All right. So if you have read and understood, considering it critical care scenario, please tell me, how would you manage this patient?
As this patient has history of fall, I would manage this patient according to the ATLS protocol,
Right.
according to the ABCDE protocol. First of all, I will assess the airway by speaking to the patient. If he is able to speak, I will give him oxygen inhalation through mask, 10 to 15 liter, and keep his oxygen saturation at 95. And if patient is not able to speak, I would look for any foreign body in the mouth, and I will do the chin lift and jaw thrust and pass oral or nasopharyngeal airways. And if patient needs surgical maintenance of airway, I can do cricothyroidotomy or tracheostomy. And after that, I will immobilize the cervical spine with hard cervical collar and also
Sandbag and
sandbag
tape.
and tape.
Yes.
And I will then assess for breathing and ventilation, check for any obvious chest injury or any flail segment. I will look for symmetrical movement of the chest, look for tachypnea, and look for and auscultate on and percuss for any hemo or pneumothorax or any added sounds. And if as patient has rib fractures, so there is a possibility of tension pneumothorax.
Okay.
So if patient has tension pneumothorax clinically, I would do the needle thoracostomy at fifth intercostal space and then pass the chest tube.
Right. Good.
Then
Thank you.
to assess the circulation, I would check for blood pressure, pulse, rate, and character. I will check for color of the skin, warmth of the peripheries, and capillary refill. And I will pass two wide bore. And if there's any obvious bleeding, I would occlude with the pressure and pass two wide bore IV cannulas and
Okay. Can you
take
please
blood
have
sample.
a look at this image and please comment on it, what you see in.
Yes, this is an X-ray cervical spine sagittal view showing burst fracture of C5,
Okay.
causing posterior displacement of the posterior vertebral body, causing probably causing the spinal cord compression.
Please comment on this second image that
This
you have
is
done.
this is chest X-ray PA view
Yes.
showing left tension pneumothorax with rib fractures, surgical emphysema, obliteration of costophrenic
Very good.
recess, and shifting of the mediastinum.
Very good. And how do you plan to manage this?
I will do needle thoracostomy
Yes, where
at the fifth
exactly?
intercostal space, and then I'll do the chest intubation.
Yes, please tell
Uh,
me, according to the NICE guidelines, how would you insert the needle or how would you do the needle thoracostomy? Where exactly?
Needle is done anterior to the mid-axillary line in the fifth intercostal space.
Okay.
In the
Then
in the
you'll
then I will do the chest intubation.
yes,
I
very good.
will I will also do the chest intubation anterior to the mid-axillary line in the fifth intercostal space in the safety triangle.
Right, exactly. When you have inserted the chest tube insertion you've done, patient has fallen into shock. How would you manage patient circulation?
I would pass two wide bore IV cannulas and transfuse 1 to 1.5 liter of crystallite solution, and also take blood sample for the transfusion and for the cross
How
match. And
frequently are you going to monitor the patient?
uh, this is a critical patient. I would be monitoring every 5 minutes. Okay.
15, okay. Right. What exactly are you going to observe?
I would look for oxygen saturation
And
uh,
quickly,
and
quickly.
ABG. I will look for blood pressure, pulse,
Yes, yes,
oxygen saturation, urine
yes.
output, and mental status of the patient.
Considering the stem, would you be able to tell me what class of hemorrhagic shock patient could be in? Or how would you
I think
determine? Yes,
I think patient has risk in this scenario has risk of pulmonary contusion and greater vasculature injury. Then I consider patient to be in fourth degree of hypovolemic shock.
not right away. For 3 to 4. Okay, 3. Right. For in order to manage urinary output, how would you classify it, or why would you consider it to be grade 4 or class 4 hemorrhagic shock? Please consider
If
and
the
tell me.
urinary
Yes,
if the urinary output is less than 5 ml, that would be grade 4
yes.
hemorrhagic shock. And if
And
it is
respiratory
between
rate should be how much?
more than 35, more than
Yes, greater
35.
than 40 actually, for it to be grade 4. What about
Yeah.
the pulse and the blood pressure? How much should that be?
Pulse would be more than 140, and
Right?
blood pressure would be deranged less than 90.
Yeah, less than, okay. Yeah, right. Less than 70, 40. Right. All right. Considering the blood loss, how would you categorize or how would you grade the class of hemorrhagic shock? One, two, three,
So
and four.
class one is 750 less than 750. Class
Yes.
two is 750 to 1500.
Yes.
Three is 1500 to 2000, and more than 2000 is class
Right.
four.
Fracture of which bones can lead to loss of 1500 to 2000 ml of blood?
Fracture of long bones like femur, tibia,
And
and
pelvis. Yes, and pelvis. What? How can you comment on the mental status of the patient? If you consider patient to be in grade 4 of class 4 of hemorrhagic shock, how would you consider the mental status of the patient?
patient would be lethargic and
And confused, yeah.
not so confused.
Right. Okay. Right. How does it affect the capillary refill time? Grade of hemorrhagic
In
shock?
hemorrhagic,
Shock, yes.
it would be increased. Capillary refill time would be increased in hemorrhagic shock.
Okay. So, right. How would you take care of the nutrition of the patient?
I would pass NG tube, and
Yes.
a critical ill patient, I would still give parenteral nutrition through IV
Yes.
fluids. But
Yes.
if patient's hemodynamic condition and consciousness settles, then I can start patient on enteral feed.
Okay. Right. This one is not settled. So you are going to give what? Which kind of fluid? And
I would give Hartmann solution
okay,
or
how much?
crystalline. I will give 1.5 liter first and see the response in the blood pressure, urine output, pulse, and mental status.
Yes.
And if it is still not settling, then I would transfuse blood.
All right. Very good. Okay. Perfect. Thank you.
Thank you.
Last question. Would you, okay, when would you have to consider giving blood to the patient? What would you consider? What are the blood products or fresh blood would you consider?
I think if patient is bleeding, I would arrange fresh blood after cross match,
Yeah.
and also arrange for platelet and FFPs.
fresh frozen plasma. No abbreviations.
Yes.
Thank you. Thank you. Good.
Thank
Right.
Ma'am,